It's now time for our next session, Secrets to Successful Potty Training. Our speaker is Dr. Michael May from the Chicago School of Psychology. Dr. May has over 20 years' experience working with children and adults with intellectual and developmental disabilities, school age children with severe challenging behaviors, and adults with acquired brain injury across a variety of settings. As part of his experience, he has development tips to help parents with what we are all here for, conquering the potty chair. Dr. May, the floor is yours.
Okay, thank you. Make sure I'm sharing the right screen here real quick. Okay, so hopefully you're seeing the right screen here. I've got several open.
Yep,
I'm
we're
Michael
good.
May. Okay, great. I am a board certified behavior analyst. I've been practicing behavior analysis for several years, primarily with early intervention and with children and adults with disabilities. I'm department chair at the Chicago School of Professional Psychology. I've been conducting research in this field for about 20 years now, and working with families from all backgrounds on various skill acquisition, various skill development with their children. And today, hopefully I can share some new information, maybe some refresher information about how potty training occurs and what has been successful in helping children learn how to navigate using the bathroom that is helpful for them in their development, and also for parents with helping their children as well. So the average age of toilet training is about 27 months. The starting process, but anywhere between the age of 18 months to 36 months of age. The right time for introducing change will be different, of course, for every child, including yours. The significant advantages for children of being potty trained include an increase in confidence, independence, and self-esteem, and opportunities for recreational and fun activities. That also includes educational and social interaction with their peers. There can be a reduction in isolation and the risk of being bullied. For parents, there are also rewards in the satisfaction of helping their child achieve this skill. There's also a reduction in the stress of continued changing and cleaning and having to plan for access to changing facilities, which is often particularly difficult with older children. Life can become relatively more relaxed. There will be significant reduction in the time and costs involved in toileting materials such as nappies, and bedding, and of course, constant washing. The time saved that can be available for other activities as well. For educators and care staff, life with the child then can be much easier with helping them stay clean and dry, as well as creating more time for them to for instructional activities and learning skills, and of course, fun time. Toilet training involves learning to understand the actions, language, and routines involved in learning to use the toilet, and developing skills and independence in managing these. There are various factors that may need to be taken into account, and not everything may be relevant to every child. However, these steps are typically what is involved in potty training. So we need to know the team, who's involved. We need to know what talk we're using. That includes words, symbols, signs, any objects or preferences, or pictures that are going to be used. And this is in preparation for the toileting. Awareness, of course, of being wet and soiled. That's an important factor as well. Territory, learning what toilets are used for. Techniques such as what clothing we're going to use, or nappies. Sometimes we wear children will wear underwear over the nappy, for example, to help them get used to that the potty training routine. Technicalities such as the seating, any kind of rails that are going to be used, and of course timers, if we're going to use timers. And that'll make more sense later when I talk about some of the techniques that are used with potty training. We, of course, need to know what we're teaching. Learning to sit, on the toilet, that requires some teaching in some circumstances, especially when they're around toilets that are loud. That's a big challenge for kids of all walks of life, whether they have disabilities or not. Even my own children had a challenge in public places where the toilet was just too loud, so they didn't even want to use it. So when it was flushing, timing, learning to manage the change, and tensions, any kind of impact of a stressful environment, and learning the new skill while they're in a new environment. Many children find it difficult to learn toileting skills, and they sometimes acquire these later than other children. Toilet training is going to involve many different things that may challenge a child, so it is helpful to look at other changes that might be affecting them. If a child totally resists potty training, this may be a sign that they're not ready yet. If a child routinely eliminates, goes to the bathroom in their pants, for example, after getting off the toilet, that is usually a sign that the child is too tense when using the toilet. Toileting anxiety can cause insufficient relaxation of the pelvic muscles and allow voiding to occur in the first place. As soon as the child steps off the toilet, the child relaxes and then they have the accident. This may be a sign of fear of the toilet or that the child is not yet ready. So we need to be aware of the surroundings with our child when we are trying to teach that skill. Children can develop fear related to the toilet. Often children will refuse to sit on the toilet because they're afraid that they will fall in the toilet bowl. Another common fear many children experience is that they fear that they will be sucked down the toilet when flushing that toilet. Many children do not have complete control over their bladder until several months after they have learned to control their bowels. So that's an important aspect to remember as well. It is also quite common for children to become completely potty trained for urine, but refuse to void in the toilet after that as well. So control the bowels. There are a number of reasons for stool anxiety refusal, including irrational fears that some kids might have, or anxieties, excessive parent-child conflict. Believe it or not, what happens outside the bathroom has an impact on the toileting routine and how fast or how quickly they learn the toileting routine. And they might have hard, painful stools as well that might cause constipation. So there's a lot of reasons that might contribute to why a child may be slower to learn their toileting technique, and it may not be because they're just being stubborn. Many children believe that their stool and urine are part of their body. Children can find this upsetting and frightening to see it flushed away. Other children are proud of their potty accomplishments and do not want to see it go away. So there's a potential hoarding that's happening while it's in the toilet. Many children refuse to use the toilet other than the one at their home. Other children will only use the potty for certain people. So we need to keep that in mind. So again, those 9 factors I was mentioning earlier we need to be prepared for that and understand who the people are, where that are going to be involved, where we're going to use the bathroom, and if there's communication between the care providers. Accidents are normal and frustrating. A normal and frustrating part of potty training. Some accidents happen because the child does not get to the toilet in time. Others happen because children are busy playing and forget to use the toilet. During a time of stress, fully toilet trained children will often regress back to wearing diapers. This most classically is seen after the birth of a new sibling, for example. Other examples of stress associated with regression back to wearing diapers are the change from the crib to a bed, a new care provider, move to a new house, the death of a loved one. So these transitional periods, these things that happen that have an effect on all of us, do also have an effect on the kids when they're trying to learn potty training. So regression is not necessarily something to be alarmed by, but aware of what those contributing factors might be. Still others, when we're talking about the difficulty that children experience with toilet training, the way in which the child experiences the world through their senses can be very different from the way other people may experience it. They may find the bathroom environment distracting, upsetting, or frightening, or have difficulties in understanding the sensations experienced by their own body. Hypersensitivity is one of these sensory processes that occur. This describes how sensation is perceived more intensely for the child. Certain noises may feel unbearably loud. Smells may be perceived as completely overwhelming, and touch may feel painful. These intense experiences can cause anxiety or even physical pain. Some of these children may actively avoid sensory input. Perhaps this is your child. They are hypersensitive to the environment around them. Your child may also be hyposensitive. This describes the awareness of sensation that is reduced and the child doesn't appear to register it at all. They may not be aware of strong smells or extremes of the temperature. They may not notice if they've hurt themselves, for example. In order to try and make sense of the world, some of these children actively seek increased sensory input. So you may see them looking for more stimulation. There are children who sometimes rock, spin, slap their hands as this stimulates sensory experiences, assists with balance and posture, and helps to deal with stress. Fleming and Collings describes several ways the sensory environment can be evaluated for effects on child toileting and problem behaviors that might emerge associated with the aversiveness of the bathroom. So what you see here are the ways in which the sensory system of the child may have an impact, or the difficulty or challenges that they may have with the experience of toilet training. So for example, touch or tactile sensory sensations of the toilet seat itself, the toilet rolls or the wipes. If they splash from any kind of splash that comes up from the toilet, especially if you're using the flush during the toileting procedure, touching the excrement that leaves their body, or the temperature itself. So all of that is touch related. Vestibular balance, it may be the toilet seat. So if you have a loose toilet seat, for example, or just getting their balance to sit on the toilet seat itself, what the proper flooring is, or even reflections that they might find that make it challenging with understanding their balance in relation to the environment around them. We might also see changes in their body awareness. So where their body positioning is in relation to the toilet, their clothing, whether or not their clothing is down far enough to use the bathroom, for example. Labels that exist in clothing that can be itchy or scratchy. So removing the labels obviously is the easiest answer there. Awareness of whether or not they have the need to go to the bathroom, whether it be to go pee or poo. And of course, navigating around the bathroom itself. And this is why it's important to in terms of readiness skills, assessing where you want them to learn to go to the bathroom. Every bathroom is different. There's new distractions in every bathroom. Some bathrooms seem really aversive. Some have a lot of lighting and things of that nature. And speaking of lighting, the next category would be visual. So the lighting may be dark or light, too light. There's several things that can be very problematic for a child when they're having difficulty. And so we really want to pay attention to what those are and if there's any differences. So it's really comparing and contrasting the environments that we're trying to teach them in. Do we want to use one area, two areas? Do we want them to learn how to use the bathroom at home, but then use nappies or diapers in public to start? Every child is going to be different. So some of the things that I talk about throughout this presentation will be for you to think about when it comes to your child, because every child is unique. Auditory, the toilet flushing, as I mentioned earlier, if it's too loud, some children don't like to flush at all, which is part of the toileting routine. We don't want them to leave the toilet with something in it. Surprise for the next person to use it. But at the same time, if it's problematic and they know what's coming, they know that that sound is coming, they may not want to use the toilet at all. So that can be problematic. If they hear echoes, sometimes you might have children who don't like the sound of the echoes and it's scary for them, or you might have children that actually like it. And so in some cases, you might hear them make the noise over and over again because they get that sensory input from hearing their voice echo over and over again when they produce that sound. And of course, like splashing in the toilet or making sounds in the water, the sound of pipes, sometimes pipes, they can hear them behind the walls, or some banging that might have some influence over whether or not they are distracted during the process. Being distracted during the toileting process is just about as problematic as avoiding toileting altogether. So we need to be paying attention to those as well. Smells can have some influence. Air fresheners, the lack of air fresheners, uh, and taste, of course. If there's air freshener in the air and they can get it in their mouth, the bathroom products that are in the air, spraying Lysol, for example, or some kind of a chemical into the air that then gets into their mouth. So there's all different types of things to pay attention to. Not all of these will necessarily have an influence on whether or not they're learning potty training. And some of them may not affect them at all. It may be that they just do not want to use the bathroom. And so we need to assess that up front, though, instead of making assumptions about what's causing the problem or that there is a problem in the first place. There is a developmental period, as I mentioned before, between the ages of 18 and 36 months is when toileting usually begins. So just right off the start, I'll mention a few tips that are important to consider before we even get started on any kind of an intervention that we want to try as a parent, or if we want to seek help from a trained professional who has experience with toilet training issues. The first thing is to think about the right time to start toilet training for you and the family. This is a group process, not just for the child and not just for the family. And so is it the right time to start thinking about doing this? Is there a transition coming that you know is going to interfere? For example, you're getting ready to change homes right at the same time that they should start learning potty training. Is it going to interfere with them learning the bathroom? So things like that we need to consider in terms of whether or not to start. Is there a change in the home in terms of who's in the home? So maybe you're going through a divorce. There may be problems with starting the process of potty training exactly at that moment until there's some coping skills that are developed with the challenging changes that are occurring in the home. And so is it the right time to start? Are the spouses on the same page? If they are splitting, are they on the same page with both being involved in the toilet training process, if they're part of the team that's going to be involved? The second tip is don't keep putting it off. Once you are through transition periods and you know that they are in that period between the 18 and 36 months, starting sooner than later is important because it does delay how quickly they learn potty training. And there's even some places that, for example, there's some child care or aftercare programs that require your child to be potty trained before they will accept you into or accept your application for services. So there are important things to remember, not to keep procrastinating, because the next thing you know, you've put it off long enough that you now have a child who's outside of that age range to learn potty training, and it gets more difficult to teach them. Third, consider the emotional readiness of the child and those involved. I mentioned this kind of links to the point number one. But is there a maturity level? Is there an emotional readiness for all of those involved that they are prepared to move forward with potty training? And for some children, this is even a rite of passage. So once they reach a certain birthday, the transition then becomes, okay, now that we've reached your second birthday, let's start potty training. And now you're going to be expected to learn how to do new things now that you've reached this age. And so it becomes a ritual or part of the transition into that process for them. Point number 4, then ensuring a good support network is in place. So individuals or care providers who are going to be involved in the toilet training routine, are they going to be consistent? Can they be counted on to have the resources available to them to do the potty training? If you have a schedule, can they follow the schedule? And are they, again, linking back to number 3, are they emotionally ready to be involved in the potty training process and understand why it's important to be involved? And then finally, make sure that everyone is involved and continuing their consistency once they start an intervention. So in other words, we can't have one method for learning potty training at grandma's house, another intervention or another strategy that we're using at our house, and then another one still that they're using in the school. That can be confusing to the child until they are ready to generalize or learn new ways of going to the bathroom if there's new environments that they're going to be going to the bathroom in. So up front, we want to make sure that everybody is prepared before we start the process. In terms of toileting readiness, if a child routinely eliminates after getting off the toilet, that is usually a sign that there tends to be on the toilet, as I mentioned before. Toilet anxiety can cause insufficient relaxation, as I mentioned before. So what we want to do is make sure that if they are going to be ready, that they can stay dry for 2 hours. That's usually an indication that they're ready to start potty training. So when we do our regular checks, we're used to changing diapers. We notice that there's a period of time of approximately 2 hours that they can handle, or that they are staying dry. That's usually an indication that it's time to start potty training. You also want to determine whether your child recognizes when they have a wet diaper. This is the easiest way to see this is if they're pulling the diaper off. If it's my children, what they used to do is actually bring me a clean diaper, lay down so that they're ready for me to change their diaper. That tells me that they know it's time to change. If it's time to change, that's usually an indication that they can start learning how to use the bathroom. And then recognize that if your child shows an interest in the potty itself or hides when they go to the bathroom. This is a common thing where we see kids kind of disappear behind their toys or they go into the closet. And then when we see them, they're crouched down going to the bathroom. So again, as I said before, if they're having accidents, if we're demonstrating that they're ready, they're having accidents, that's these are the indicators that they are ready. And once they start having those accidents, then we can that's when we know that it's time to start paying attention to the strategy that we're going to use for teaching the potty training. As previously stated, like I said, the positioning sometimes can be a problem because they eliminate before they get off the toilet, or they eliminate when they get off the toilet. That can be fear related, of course. It could be insufficient relaxation because of the tension. So our muscles are too tight to release what it is that we need to release. So what we want to do is if a child's afraid of the toilet, the best thing we can do is to try a small toddler potty. Some of us have probably already tried that. So some of this is not going to be new, but this is leading up to interventions you can try when you know it's beyond that point. You sit the smaller potty by the larger potty. Of course, it's less intimidating than an adult-sized toilet because the child sits on the small potty. The feet are flat on the floor. That produces a little bit of safety. We don't realize how much, or maybe you do realize that it not only helps you with the balance, but it gives us a little bit, especially if you fear heights, for example. If your feet are on the ground, you feel safer. And it's the same way with sitting on a toilet for kids. It's less intimidating. And so because they feel relaxed, it's easier for them then to have a bowel movement. After using a small potty for a period of time, when they use that potty, have them empty it, because then they realize that that once they go to the bathroom, whatever they did, whether it be pee or poo, that goes down the toilet. And so then they can empty their smaller toilet into the larger toilet and flush it, keeping in mind that the sound of the toilet flushing may be problematic for them for a while. And so we have to take into consideration any kind of reduction or eliminating that sound for them. And it may be something as simple as earmuffs or earplugs to help them cope with the loud sounds. And until they're ready to remove those plugs, you don't want to make it a tense experience for them. So after they emptied into the adult flushing, over time, the child will realize that flushing is safe. And so because it is safe, they can then start to slowly migrate to using the larger toilet. If the child only recognizes the need for bowel movement, if they recognize the need, for bowel movement, praise them. That's an important aspect here. A lot of the strategies that we've used over the past have been shaming, right? So, oh, we don't go to the bathroom in our pants, we go in the toilet. So those shaming techniques are usually not going to be very helpful. So we want to focus on what they are accomplishing, even if it's small steps at a time, and praising what they did do. So maybe they went to the bathroom, they already soiled themselves, but they did go to the bathroom because they're starting to recognize that's where they're supposed to go. So celebrate the little achievements along the way and not leave them out, because if we're only waiting until they are fully potty trained, they're not really getting much praise from you for that. So it's not very encouraging. So once they learn how to use bowel movement, then the urine control will follow. So they start using the toilet, they sit on the toilet, they can empty the smaller toilet into the adult toilet. The urine control then starts to occur after that, where you start to see them using the toilet, going to the bathroom to use the toilet before they actually urinate in their pants. If the child asks for a diaper or to stool, and is having regular soft bowel movements, it is likely that they are afraid of stooling on the toilet. So that usually is an indicator to you. So to us, it seems rational. So we're wanting to tell them, if you can do that, then why not go to the bathroom in the toilet? So while it's rational for us, they are trying to control their environment the best that they can in a very uncomfortable situation or a stressful situation for them. And so if they're afraid, then initially parents should allow the child to have the diaper to stool. You don't want to stay that way. That's the problem that some parents might run into, is that we become comfortable with that's just the way it is. They'll go urinate in the bathroom, but they won't have a bowel movement without a toilet on or a diaper on. So we just constantly give them a diaper. I've even had parents who with children who they started potty training with their child in the bathtub full of water. The child would defecate in the or have their bowel movement in the shower in the bathtub. The parent thought that they had found a miracle cure for why their child wouldn't go to the bathroom, but yet the child would not go to the bathroom unless it was in the bathtub with water in it. And as you can imagine, that means that the kid's only going to the bathroom at home. And so in public, there isn't a bathtub they can just jump into and go to the bathroom. So it makes it problematic. And then the parent gets into that routine. It becomes a habit. And that habit is a little bit harder to break once you've started that habit. So letting them have a diaper initially is important. Bring them into the bathroom and have the stool into from the diaper near the toilet. So once they're comfortable, they can you can have the child try and sit on the toilet to stool while wearing the diaper. And then the next step, so sequentially, let them go to the bathroom in the diaper. Have them go. Next step, have them go to the bathroom with a diaper on next to the toilet. Next step, have them sit on the toilet with the diaper on. And then finally have the child sit on the potty without the diaper. So it's stepwise. So you're easing them into the appropriate toileting technique to begin with. If they get upset while they're flushing contents, spend time explaining to them about how everyone makes waste, make flushing the toilet a reward for doing a great job of going potty. If a child is afraid of unfamiliar toilets, start at the home of a familiar person, like your house or a friend's house or grandmother's house. If the parent needs to take the child to public restroom, bring the child's home potty chair or their toilet seat cover with them, so they have some familiarity, and stand in the doorway, introducing them to support people and fade them out as needed. So in other words, don't just leave them with somebody new that can create a stressful situation for them. So make sure that you're with them until they feel comfortable, and then you can back out. So far, we've been looking at simple ideas to set the stage for the child to naturally start using toileting on their own, the toilet on their own. When individuals do not acquire toileting skills naturally, however, intentional efforts have to be made. And that's usually when we have some sort of intervention, either because it's given to you by a professional, or a professional is helping your child learn how to use the bathroom, and different forms of interventions are developed for that. A few intervention strategies have been developed since the early 1970s. Through the present day. I can tell you early on, they focused a lot on overcorrection. And what that basically means is that the child had to clean up the mess that they made. And so it was a very aversive situation. But there are strategies, though, that are very positive for children to learn how to use the bathroom. And so one of the early studies for kids with intellectual disabilities was conducted by Addison and Fox in 1971. The authors used a wet alarm apparatus that was worn by the participants in the study. So basically, every time the individual wet themselves, the apparatus would make a sound or an alarm to cue them that they had an accident. They paired that sound of the alarm with the feelings of being wet. So that allowed the child to start, or the individuals to start learning how to recognize when the sensation of being wet was being experienced. So it's a prompt. This paired the sound of the alarm then to with the feeling of being wet to increase the number of urinations. The participants were given fluids every half hour. They also had scheduled toileting every half hour to increase the number of opportunities to use the toilet without having an accident. To reinforce dryness, the individuals were given edible and praise, and edible, something to eat, and praise, way to go, for being dry every 5 minutes, that they remain dry. Remember that this is a research study, so practically speaking, it is difficult for parents to attend to potty training every 5 minutes. As you know, there's other things that we have to do. This just demonstrates that the procedure works. So it has to be adapted to your particular schedule at home and the incontinence schedule of your child. So in other words, create a schedule of fluids to encourage going to the bathroom, and then scheduled potty breaks. That includes the praise for remaining dry, or if they start going to the bathroom on their own before they go into the potty, naturally you want to praise them for that as well. Prolonged use of diapers delays potty training. So that's why before I was mentioning you might start that way, but you want to quickly fade out of using diapers as quickly as you can. And it can also create infectious diseases. So if they wear a diaper too long, they can have get rashes, urinary tract infections, things of that nature. So Simon and Thompson in 2006 reported a study comparing the effects of wearing disposable diapers, pull-on training pants, and underwear on the urinary continence of 5 typically developing toddlers ranging in age from 21 months to 30 months who had not yet been potty trained. During the phases when snacks and beverages were provided, the children were checked for wetness every 15 minutes. So there you see, every 5 minutes isn't necessary. They were praised for diaper dryness and given dry diapers when needed. Throughout the study, teachers and parents provided opportunities to use the potty every 30 minutes, and then prompted to use the toilet, and praise and approval given for dry diapers, very specifically because of the dry diapers. If children used the potty and that they would then have temporary access to a preferred activity, their data showed that wearing underwear increased continence in 2 of the 5 children. There was no effect on 2 of the others, and it had favorable effects on the 5th. So what that shows is that it depends on the child, but what it does do is give you an idea of the systematic way in which they made sure that they were keeping a schedule and praising dryness and going to the bathroom, and keeping special toys aside or special activities aside that they may find beneficial while they are learning to use the bathroom. It's not something we want to withhold from them all the time. Naturally, you want them to have toys to play with, things to do, but keeping in mind that you have to have that special toy or that special activity that is set aside only for when they accomplish whatever step you're in or whatever goal that you have set for that particular day or week for the potty training activity. Two parents in another study that was conducted by Halligan and Lubin looked at a very similar procedure, praise for dryness, activities for staying dry, and a schedule of going to the bathroom. Two parents were concerned because their two young girls were delayed in learning to use the potty. The authors obtained data about the frequency of their wet diapers and used the potty at home. So we can do that too, keeping track of small accomplishments. So are there fewer wet diapers? Are there fewer soiled diapers? Are we not wetting in our pants, or are we wetting in our pants fewer times during the day? Those are small accomplishments. Don't wait until you have a day where it's no potty, no mess in the pants at all. So an intervention was implemented that involved increased intake of fluids and salty foods that prompted drinking more fluids, then prompting them to go to the bathroom, and then using what we call reinforcement or rewards for completing the task. There's a substantial decrease in the wet diapers, together with an increase in the use of the potty, and the girls were offered opportunities to wear princess underwear when they were dry. So if they met their goal for the session. During the first intervention, they were given access to the salty foods and juice, checking the diaper every half hour, verbally prompting them to use the toilet, such as, do you need to use the potty, or would you like to be a big girl and try to use the potty? Or once you use the potty, every time you can every time you use the potty, you can wear your princess underwear. Every time they used the toilet, they were praised, in addition to the toilet underwear, or the princess underwear, of course. After several interactions, they began to verbalize their need to go to the bathroom and would spontaneously use the toilet. So once the girls were telling the investigators, the researchers, that they needed to go to the bathroom and use the potty at least 90% of the time that they had to go over 3 days, then that's when they got access to the princess underwear. So a structured plan would be really good for any family to use, and again, adapting it to what fits your needs. If you have a little boy who's interested in Superman, maybe you can wear Superman underwear, for example. If 30 minutes is too long, you think, then shrink it to 15 minutes. If 30 minutes is too short, increase it to 45 minutes. So you can use these systematic interventions that best suits the needs of your child and what you can accomplish. So what these graphs show, just kind of show you that I like to see achievements and not just kind of gauge whether or not I think they may be making progress. And so what you see here is that when they were given snacks and juice, there was a lot of diaper wetting. But when the girls were given prompts to go to the bathroom and praise for going to the bathroom, you see that the number of diapers decreased. So that's what that first graph is showing you. What the second graph is showing you is the frequency of dry diapers or dry pants. So naturally, if they're getting a lot of snacks and juice, but not yet being praised for using the bathroom and not having special princess underwear, you see that they had dry pants a lot less frequently. But what the next section shows is that when they were given the juice and the snacks, prompted to go to the bathroom and then praised for it, you saw many more dry diapers. And then when they added the princess underwear, you see that it had about the same effect as using praise. And so again, this just emphasizes using proper proper activities or special toys or treats that are set aside specifically for toileting that they can't have at any other time. But that doesn't mean take everything away from them. That means to only use a special toy for that special or a special activity for that potty training activity. Flora and colleagues recently used a procedure that's called Potty Party. This is essentially the same. I don't want to spend a lot of time on this due to time. But what this is showing is that the training methods were essentially the same as the previous study I showed you. The difference is that they would sit on the toilet itself for a potty break. On the potty, they were given liquids and less preferred rewards for sitting on the toilet. So engage them in an activity that they wanted to do, such as a daily living skill that they might be practicing, or practicing their alphabet, or playing a game that's not really the game that they like the best. Again, because you don't want to give them the best thing that they can have until they actually complete the task. So they would sit there for a period of time. You don't want to sit all day long, but for several minutes, give them the chance to go to the bathroom. If they voided, in other words, they peed or went poo in the toilet, you give them praise. And a more highly preferred edible treat, something they really enjoy. Then off seat, when they get off the seat, then you give them time with their favorite activity or item that they want. And what this basically showed, not going into a lot of detail here again, is that when when they used a potty party, you saw a lot less accidents, and you saw more toilet use by the kids, and that the toilet use is indicated by the dark black squares on the graph. So it was effective for a couple of the kids that they were working with. And again, you're going to see that from time to time because not everybody is trained the same way. So what are the big ideas across all these studies? It wasn't really my intention to go into a lot of detail about research studies. It's just to show you that we've looked at ways that help children improve and help families systematically design ways to help their kids go to the bathroom. So what do they all have in common? Snacks and activities prior to toileting, a set potty schedule, prompting them to use the toilet until using it frequently. And once they're using it frequently, you don't have to prompt them anymore because they start using it on their own. Use small value reinforcers for attempts. And that's important. Attempts are important. We need to praise and reward those. Using bigger value rewards or reinforcers for accomplishments. So once they actually get to the point that they meet their goal, then that's when they get the bigger reinforcers. What this is showing you is a way that you can kind of, for toilet readiness assessment, keep for yourself. This isn't for you to necessarily use on your own, but just to kind of pay attention to any kind of challenges they might have. Do they have any? Do they always, often, occasionally, or never use the bathroom? Do they understand what the bathroom is? Do they have the motor skills available to complete the activity? Keep a chart of their bowel and bladder record. So that can tell you it's an indication for you is, are they increasing the number of outputs in the toilet? Are they dry more often when you check in intervals? And that helps you, it prompts you to praise them. It prompts you to reward them when they meet their goals, or when they achieve a small accomplishment of getting closer and closer to being potty trained. So keep a schedule for how that works. Create a plan and a checklist to teach. So become aware of the needs to go to the bathroom, recognize the need to go to the toilet. When you're in the bathroom, going to the toilet, pulling their pants down, sitting on the toilet in front of sitting or standing in front of the toilet, going to the bathroom in the toilet, pulling the clothes up, flush the toilet, wash their hands, and then reward. So you can create a checklist that helps you systematically help your child learn how to use the bathroom. They can look at this themselves and monitor how much progress they're making. And then you can celebrate the small accomplishments with that. Just a word on those rewards that you're using. We want to make sure that we use them for both effort and success. So along the way, they need to make sure that they're being encouraged. Should always be achievable targets and step toward success. So make sure that they can actually achieve what you're accomplishing. Don't over don't oversell it. Don't make it too difficult for them. Make it something that's achievable. Set aside reinforcers that they don't have for a special reward. You may need a variety of rewards for that. Instead of just one, they might get tired of the one that you're using. And it should not be high cost. Use small things that don't cost a lot of money. You don't want to get into the habit of giving them expensive gifts for that. So what are these reinforcers? They're any activities. They're extra time with a favorite toy, praise, cheer, high fives, any stars or stickers that you want to use, marbles in a jar, and a special prize when the jar is full. So every time they go to the bathroom, put a marble in it. And once it fills up, make it a small jar. And then once it fills up, they get a special reward for it. All right. So they can call family, coloring books, things of that nature. So anything you can think of that your kid likes, use it as a reward for small accomplishments and for successes. So with that, I know we're out of time, but I will stick around for questions if folks have questions at this time.
Yes, I've got several questions, and we may not get to all of them, but
Okay.
we'll send them to you so you can answer, and we'll send them out in an email if that works.
Sure.
Because we do have several questions. So we'll get to the ones we can. What the first one is, does it matter if dad shows son how to potty train? In other words, is it easier for the same genders to mainly potty train the child, or does it matter?
It's going to depend on the child. You're going to hear that a lot. But modeling can be a real powerful technique. So seeing how it's done essentially is very helpful. However, you have a lot of single mothers out there who still have a son that they have to potty train, and they probably don't feel comfortable having their son watch other males go to the bathroom. So I don't want to say that modeling is absolutely necessary. Uh, that's where it becomes important to teach them standing in front of the toilet, and it's okay starting out with sitting on the toilet too. They don't have to immediately go to standing up to go to the bathroom. So that's probably the easiest way to answer that question. So it depends. If dad is willing to be a model for it, that's great. If it's not, but it's not absolutely necessary.
My next question is, I have a miniature toilet for my daughter. It just looks like ours. We've practiced pulling down pants and sitting. I can have her sit for about 2 minutes before she needs to get up. Sometimes we play a grunting game in hopes that the grunt may help her push. We practice grabbing toilet paper and her toilet as a flush that mimics the flush noise. We do the entire routine, but she never actually goes. Should I just keep at it? Or maybe is there something else I could do to encourage her to go? She does not tell me when she has to go yet, but she will indicate to me that she has gone.
Okay. So is this for voiding or urinating?
I think it's probably both.
Okay. And then when she gets off the toilet, she goes ahead and goes to the bathroom in her pants.
Yes.
Okay.
I'm guessing.
Okay. Very good. Another thing you can try is just the toilet lid on the main toilet. The key too is, that this sounds to me like they're trying the potty party technique, and it may be that you have to back off of the potty party. Without me helping with the assessment, I'm just giving a shot in the dark here, but trying one of the other methods of encouraging going to the bathroom on the regular toilet, or even backing it up from the toilet to telling when they have to go to the bathroom, or using the main toilet, and then just using a schedule of the treats, the bathroom breaks, and then reprising going to the bathroom to go into the bathroom, even if they're not using the toilet. And then again, backing up to using the powerful rewards for when they actually go, and smaller rewards when they don't. So in other words, don't use the potty break, the potty party, but use one of those other techniques of getting them into the bathroom, giving them drinks and snacks frequently, and then checking in and going to the bathroom more frequently. I'm not sure what the schedule is, but I would check to see if maybe you need to go into the bathroom more frequently. And then that way you can try to catch one of the times that she's going to the bathroom. And then you can praise that. And then it makes just so what it sounds like is she's not making the connection of going to the bathroom to go to the toilet. Going to the bathroom is becoming a fun time. And so there's a different, she's taking it in differently. And so that's one way to handle that.
So next one I have is at what age should a child typically not wet the bed anymore?
That's going to depend on a lot of factors. I mean, you have there's a medical disorder that's called I can't remember the name of it off the top of my head. So there could be a medical cause for it. There could even be what's called enuresis, which is bedwetting that could be caused by a medical disorder. It could be a urinary tract infection. I don't want to alarm anyone on this call, but sometimes that is also an indication, and you want to have it medically checked. It's not something you want to just make an assumption about, but there could be a history of trauma with the child that they're experiencing that could be problematic for them, and it's causing more wetting. The age at which they should not be wetting the bed anymore. Clearly, when we get up to the age of 5, that's getting about the age that it becomes strange for parents. That's when they start to see that it's a little abnormal to see the bedwetting occur. But again, I've seen bedwetting all the way up to age of 10 for girls who have been traumatized in some way. So it just really depends on the kid. So I can't really give a strict answer to that. Usually by the age of 3, though, children are fully potty trained.
I'm going to go with one more, and then the rest we will send out. So this last one, because it's a long one. So this question is in regards to our child is ready to begin potty training. Our 27-month-old son can stay dry for 2 hours and hides to poop. He also seems to recognize when he's wet or dry, but it doesn't bother him at all, and he doesn't ever want to stop what he's doing to have his diaper changed. Do we need to wait until he's bothered about his dirty diapers and or wants them changed before we begin potty training? Or is his awareness of having a dirty diaper enough of a sign he's ready to begin?
Okay. Again, I'll preface this with until I did an assessment, this is all just ideas without knowing fully the circumstances. And I can sit here and ask questions all day to try to figure out how to pinpoint that answer for you. But generally speaking, I would not leave a kid in a dirty diaper. The sensation of what it feels like to them may be slightly aversive, but not enough to warrant them coming to you to have their diaper changed. So they might hide to go to the bathroom. So in that case, I would, initially what I would start doing is not making a big deal about it when the cleanup process happens. So limit your conversation, limit the talk, don't show disapproval, but just don't attend to it. Just clean them up, move on to the next thing, don't attend to it. As soon as you clean them up, they get dry, then praise it. Yay, we're dry. We don't have we don't have a dirty diaper anymore. That's a wonderful thing. And make it a big deal that they don't have a messy diaper. And the contrast between not saying anything at all when you have to clean them and them having a clean diaper may be enough to prompt them to start using the bathroom.
All right. Well, thank you so much, Dr. May. We really appreciate you being a part of this event, and we know that everyone here benefited greatly. And like I said, we will get your answers, your questions answered and get them out to you. So thank you so very much. We greatly appreciate it.
All right. Thank you.